بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. Dear students, this is Ahmed Libyari, Professor of Clinical Toxicology. Today, inshallah, we will start talking about clinical toxicology, starting with the general principles. We have four topics to talk about. First, factors affecting toxicity. Then, we will discuss how to diagnose cases of poisoning, how to prevent them, and finally, how to treat poisoning cases. Let's start with factors affecting toxicity. This is an important question. What is poisoning? Any person presenting with multi-system manifestations due to intake of something, maybe a drug, maybe a pesticide, leading to these manifestations which may end in either death or ill health. This could be a case of poisoning. What poisons do you know? Of course, some poisons are famous of being used as poisons. For example, arsenic and pesticides. But other things may also cause poisoning. Even useful saying. For example, drugs. If they are taken in overdose, they may cause poisoning. And so, Paracelsus, which is a German scientist, coined this idiom. All things are poison. All things, and nothing is without poison. Only the dose. Only the dose makes a thing not a poison. We agree with Paracelsus in most of this idea, but it's not only the dose. Other factors may play a role. These factors may be related to the poison, of course, or related to the person. Factors related to the poison. Of course, the first and the most important factor is the dose. The greater the dose of the poison, the more dangerous the manifestations. Then the state of the poison. Poisons in gaseous forms may be absorbed in a more rapid way than those in the form of liquid or solid material, for example, a fine powder or a big lump. And the route of administration is also very important. Poisons injected intravenously have a more rapid action than those taken orally. Other factors are related to the person himself. Some persons are allergic, and so beneficial substances, for example, penicillin, this is a beneficial drug, may cause harmful manifestations in those persons allergic to penicillin. A patient may have idiosyncrasy. This is a genetic abnormality. For example, glucose 6-phosphate dehydrogenase deficiency. Those persons with this abnormality, if exposed to certain drugs, may have dangerous manifestations. For example, those persons with glucose 6-phosphate dehydrogenase deficiency, if exposed to salicylates, this is a beneficial drug, aspirin, those persons may get hemolysis of RBCs. A person may have tolerance to a certain drug, for example, opiates, morphine and tramadol. Taking large doses of these toxins or these drugs may not produce the same effect. Sometimes synergism may occur. For example, a person taking alcohol and barbiturates. Both are seen as depressants, and the intake of both at the same time may be associated with greater and very severe form of CNS depression. What about the diagnosis of toxicity? In general, we diagnose any case in medicine by a triad of history, then clinical examination of the patient, and finally, we may need some investigations. History in poisoning may have some advantages. You can know the type of the poison or the toxin, you know the amount taken, and so, which may facilitate management of the case. However, sometimes the history may be unavailable if the patient is presenting comatose, or may be unreliable if the patient is lying due to fear of responsibility, for example. When examining a patient, you may have some signs. The collection of these signs may point to a certain toxin. We call these toxidromes or toxic syndromes. So they can be defined as a collection or a group of signs and symptoms that consistently point to a particular toxin. We have some famous examples of toxidromes, starting with narcotic toxidrome, which may result from exposure or intake of opiates like morphine or tramadol. Patients will present with constricted pupil, even pinpoint. Consciousness, of course, is depressed, and the vital signs are also depressed. The patient may have bradycardia, hypotension, hypothermia. Sympatholytic toxidrome, due to intake of sympatholytic drugs like clonidine, for example, those persons are presenting with very close picture, close to the narcotic toxidrome, except those persons, when injected with naloxone, will produce no response. But narcotic toxidromes, if a patient is presenting with narcotic toxidrome, the injection of naloxone may be associated with reversal of most or all manifestations. Another toxidrome is called the cholinergic, due to exposure of cholinergic agents like organophosphates and carbamates. The patient may present with symptoms like defecation, urination, meiosis, bronchorrhea, vomiting or emesis, lacrimation, and salivation. Of course, these manifestations are due to excessive acetylcholine release. So, this toxidrome is called cholinergic. Anticholinergic toxidrome may result from the exposure to anticholinergic agents like atropine, and other agents with anticholinergic effect, like antihistamines. Patients may present with A, B, C, D, and E: agitation, blurred vision, constipation and urine retention, dry, hot, flushed skin, and of course elevated temperature or fever, and heart rate, that's to say tachycardia. Sympathomimetic toxidrome may occur due to exposure to agents like cocaine, amphetamines, and other sympathomimetic agents. It's similar and very close to the picture of anticholinergic toxidrome, except two manifestations: sweating and bowel sounds are increased here, but in the anticholinergic toxidrome, there is no sweating and no bowel sounds heard. The importance of noticing the different toxidromes is the faster recognition of the toxin, faster recognition of diagnosis, which may help initiation of therapy in a faster way. However, patients may present sometimes with atypical presentation. For example, a patient exposed to tramadol. Tramadol, of course, is a narcotic analgesic, and the patient presents with narcotic toxidrome, but sometimes may present with seizures. This is a typical presentation. The third important point for diagnosis is performing some investigations to confirm the diagnosis. Sometimes we use the ECG or electrocardiography, or perform some laboratory tests, either toxicological screening or specific toxicologic tests, or the routine medical investigations. And sometimes we may order some imaging procedures for the patient, like X-ray, magnetic resonance imaging, MRI, or ultrasonography. The aim of these investigations is to confirm diagnosis, but they may be helpful in another way. Let's see. A plain abdominal X-ray may show some radio-opaque shadow, which may be one of these. It is either bismuth or any drug in enteric coated form, or it is tricyclic antidepressant, antihistamine, calcium, heavy metal, iron, or potassium. Any of these may appear as radio-opaque shadow. This is a mnemonic called beta chap. These are radio-opaque toxins which may appear in a plain abdominal X-ray. Of course, this is not helpful for the diagnosis. And radio-opaque shadow in an abdominal X-ray may be any of these, but helpful for follow-up of treatment. This person should have one of the GIT evacuation techniques, for example, gastric lavage or whole bowel irrigation. You may take another abdominal X-ray. If you find the radio-opaque shadow has gone, then your technique of GIT evacuation is successful. So, investigations are not only helpful for confirmation of the diagnosis, but also they may direct your treatment, follow up your treatment, and sometimes you can detect some complications some remaining complications in your case. All of these could help better management of your patient. Take care. Most of the acute poisoning cases are emergencies, so you have to do your examination rapidly, thoroughly but rapidly. And the repeated evaluation of your patient is very important because poisoning cases are usually dynamic, not static. The case is changing from minute to minute. In the vast majority of cases, blood tests that are most useful in the diagnosis are the non-toxicologic routine tests. They give you a picture about the performance of the organs of the body. Sometimes the specific toxicologic screenings or toxicologic assays are important. For example, if you are measuring the level of paracetamol. This is important because you can take a clinical decision to give a specific antidote or not based on this. But in the majority of cases, the routine tests are the most useful and the most helpful. What about the prevention of toxicity? Most of the cases of poisoning occur at home. And more than half of these cases occur in those children, young children, younger than 5 years old. So we have to poison-proof our homes against those children to make it safer. We have 4 tips. First, storage tips. You should store medicines and chemicals in their original containers. So, in any case of poisoning, you can know the substance causing the poisoning. You have to lock medicines and household products and chemicals and dangerous materials in locked cabinets away from children. And you have to separate drugs and chemicals from foodstuffs, from household food. Keep them in separate places. The second category is about prevention of poisoning from medicines. Never to take a medication in the dark. You have to see it to identify the medication and the dose taken. Don't call a medication a candy, otherwise a child may go to take it every now and then. And don't take medications in front of children. They are fond of imitation. Third tips about they are general poison prevention tips. Generally, at home, don't mix chemicals. You are not a chemist. Chemicals are dangerous substances. Sometimes mixing chemicals may lead to elaboration of dangerous gases. Keep your appliances, stoves in a good repair to avoid carbon monoxide poisoning. And take care of those children. Never to leave them alone with chemicals in the home. And the fourth category is the most important. It's about keeping the poison control center number, the phone number of the poison control center in your area beside the phone. And this is the number of the poison control center in Tanta University Hospital. The last part of this lecture is about treatment of toxicity, the general principles of treatment. This is our body, a toxin. Exposure to a toxin may cause actions that present with manifestations. The toxin entering the body, producing these actions that appear in the form of manifestations, but the body is trying to get rid of the toxin, trying to eliminate the toxin. How to deal with this dilemma? Prevent toxins from entering the body. Prevent absorption of these toxins. This is called prevention of absorption or decontamination. You can also help elimination of the toxins from the body, enhancing elimination of the toxins. Or you may give some drugs to antagonize the actions of the toxin. And finally, you may manifestations. Any of these could be helpful in most cases of poisoning. So we have 4 major lines of treatment: decontamination, administration of specific antidotes, symptomatic or supportive treatment, and finally enhancement of elimination. In your opinion, which of these lines is the most important? Is it the supportive treatment or the symptomatic treatment, or decontamination, or administration of specific antidotes, or enhancing elimination? Sometimes you may try to prevent absorption of the toxin using one of the decontamination techniques, for example, gastric evacuation or gastric lavage. But the patient may present with another route of administration. The patient may take the toxin by parenteral route, by injection. Then decontamination would be inefficient. Specific antidotes are very important, but we have so many toxins, thousands or tens of thousands, but we have only very limited number of antidotes. So a great number of toxins have no antidote. Enhancement of elimination. The techniques for enhancement of eliminations may not be beneficial with a large number of toxins. But in every case, the good supportive treatment could be helpful. Symptomatic treatment is very important, starting especially with the emergencies. That's to say, any problem affecting the airway, breathing, or circulation, or the ABCs. To wrap up, we have discussed factors affecting toxicity, and the dose, of course, is the most important, the dose of the poison. But we have other factors related to the poison and also factors related to the person. Diagnosis of any case of poisoning depends on the triad of history, examination of the patient, and you may perform some investigations. Prevention, starting with the storage steps, prevention of toxicity from medications, and general tips, and keep the phone number of the local poison control center beside you. Treatment, you have major 4 lines: enhancement of elimination, administration of antidotes, decontamination. Of course, they are important, but in most cases, the most beneficial treatment line would be the emergency and the supportive treatment or the symptomatic treatment. These are the main topics in our lecture today. Thank you, and Assalamu alaikum wa rahmatullahi wa barakatuh.